Why do doctors order a sleep-deprived EEG for epilepsy? Imagine trying to catch a fleeting moment, something that might only happen once in a while. That's often what doctors face when diagnosing epilepsy. They need to see the brain's electrical activity during a seizure or just before one occurs. A sleep-deprived EEG is a special test that helps make this easier. It's designed to increase the chances of catching abnormal brain signals that suggest epilepsy. An EEG, or electroencephalogram, records the electrical signals in the brain. It's a crucial tool for diagnosing epilepsy because it can show patterns called epileptiform discharges. These patterns are like fingerprints indicating a tendency for seizures. But sometimes, during a routine EEG when the person is awake, these patterns are hard to find. They might be absent or hidden because brain activity varies, and certain discharges only happen during sleep or specific states. That's where sleep deprivation comes in. By reducing or eliminating sleep the night before the test, the brain becomes more excitable. This increased excitability makes it more likely for epileptiform discharges to appear during the EEG recording. Sleep deprivation acts as an activating factor, revealing abnormal activity that might otherwise stay hidden. It's like turning up the volume to hear a faint sound more clearly. Research shows that adding sleep deprivation to EEG testing significantly improves its sensitivity. For example, in patients with generalized epilepsy, the chances of detecting abnormal activity can rise from about 17% with a routine EEG to around 60% with a sleep-deprived EEG. This means doctors are more likely to find evidence of epilepsy, especially when initial tests are inconclusive. Doctors often order a sleep-deprived EEG when they suspect epilepsy but don't see clear signs in a standard EEG. It's particularly helpful for certain types of epilepsy that tend to occur during sleep, such as absence seizures or myoclonic seizures. The test usually lasts 1 to 2 hours and is performed in a quiet, comfortable setting. Electrodes are placed on the scalp to record brain activity while the patient relaxes or sleeps. It's important to note that sleep deprivation isn't equally effective for all epilepsy types. It tends to be more sensitive for generalized epilepsies than focal epilepsies. Also, the procedure requires careful preparation. Patients are advised to avoid caffeine and to limit sleep the night before to maximize the test's effectiveness. While it might sound uncomfortable, sleep deprivation EEG is a safe, non-invasive way to gather vital information. In summary, doctors order a sleep-deprived EEG to increase the likelihood of detecting abnormal brain activity related to epilepsy. By making the brain more alert and responsive, this test helps confirm a diagnosis when other tests don't provide clear answers. It's a valuable step in understanding each individual's epilepsy and guiding effective treatment. If you're scheduled for this test, follow your doctor's instructions carefully and remember that it's a safe, helpful tool in managing epilepsy. Always consult with a healthcare professional for personalized advice and diagnosis.